Good morning and welcome back. It's just about 12 minutes before 7 o'clock. Now, there's plenty we can do for our health to try and prevent a trip to the doctor. Some of those things are just plain common sense. Joining us to talk about those things this morning from Gundersen Health System is Dr. Sig Gundersen. Dr. Gundersen, thanks for waking up with us this morning.
Good morning, Destin. How are you?
I'm doing well, and I hope you are doing well.
Great.
Also. The first question I want to ask is, what can we do as a community to reduce the risk of infection?
Sure. I think one of the things that's really important to understand is that infection in the community, 80% of infection can be traced back to good hand hygiene. So washing our hands, whether we're in the community or in the hospital, probably one of the most important pieces of actions or things that we can do to get infection rates lower than they are.
It's almost like a simple way to, I don't know if I'm using this word correctly, immunize yourself against infection just by taking those extra couple of seconds. How exactly should people wash their hands?
Sure, it is a very good way to immunize yourself, as you said, and take precautions. So hand hygiene is very simple in this day and age. It doesn't need to be soap and water. It can be an alcohol gel. They work very well. They've been proven scientifically to be as effective as hand washing. You need about 15 seconds of contact as you're doing this. And most people will talk about singing happy birthday once through while you're gelling in or gelling out. The important thing about it, I think, is that most of us in healthcare are aware of this, and yet it's a very simple piece that we often forget. And we can ask our patients and our community to help us, actually, by reminding anybody that comes into their room that they ought to gel in or gel out, or ask them if they have.
And when those gels aren't available, soap and water is, I guess, the traditional way of doing this. 20 seconds, I find that interesting. It's the scrubbing that's important, right?
It is. It's both the mechanical scrubbing, but also the chemical contact that kills the germs on our hands.
So the chemical contact, just always make sure, I guess, anytime you do something that you think you could possibly be contaminated or have touched a contaminant, just wash your hands.
Right. We talk about 5 points. 1, entry the room. 2nd, whenever we're going to touch her and be involved with the patient. Afterwards, exiting the room as well. So I think in public, you can think about any time you're going to prepare food, eat food, use the bathroom, those types of things, very important.
And it's just, as I said earlier, just common sense, but it's a lot of times overlooked by people.
Common sense, but often overlooked. Most studies in large hospitals would suggest that it's only done about 40 to 50% of the time. So we have a very big program going right now to see if we can elevate our incident up above 90% or better.
All right. Well, always a good goal to strive for. Dr. Gundersen, thank you so much for joining us this morning.
You're very welcome. Thanks, Dustin.
And